Okay, welcome everybody. Once again, this is Mr. Reyes with Careers Unlimited. And today we're going to be discussing a very important topic in the course of the nursing assistant. This topic is one of the most essential chapters in the entire course because it covers a lot of the essential skills that you'll be needing to function as a health care team member. So it's really important that these following objectives be mastered as highly as possible. If you don't allow yourself enough time to learn these, you're going to find it difficult to transition and use some of this knowledge in the practicum area. So it's very important that you pay close attention to the topics in this chapter. The chapter is called Basic Nursing Skills, and in this chapter we're going to start discussing the admission process. What happens when a resident first comes into the facility? And at times, the patient sometimes may be transferred to another facility or maybe within the same facility to another room. What is your role as far as a patient when they first come in and when they move? And of course, finally, when the day comes, when they get to go home after perhaps a short or lengthy stay, what is your role with the resident when you're waiting ready to discharge this patient home? We're also going to be looking at the importance of monitoring vital signs. To me, as a healthcare team member, it is essential, crucial that you master this information because this is your baseline, this is your foundation, and you need to create a very strong foundation in as a nursing assistant so that you can be a very effective and efficient nursing assistant. So please make sure we master the vital signs as we cover them on later on in the discussion. Next, we're going to be learning how to measure weight and height. Why is it important that you as a nursing assistant provide this basic baseline information? It is crucial because we use it in many areas. We have to keep track of the residents' weight. We don't want to fall into unintended weight loss or malnutrition, dehydration, and so on. So this weight measurement is actually one of the most important topics, and you may be tested in your certification exam. Now, the height is also important, not so much because we need to keep track of it because we're not growing anymore, but because the pharmacies will use this information to calculate some medications dosage that may be required at times. We'll follow the conversation with the next topic, which is restraints. Restraints is a almost a bad word nowadays. Back in the early days of nursing, restraints were utilized very freely without restraint. And well, we found out the hard way there by using or overusing restraints, it can actually cause more harm than help. So we'll be looking at those and what has uh, what has happened since the early days of using restraints overly. We need to also be aware how to promote a restraint-free environment. Now that we're very limited in the use of restraints, you have to keep in mind how can you manage a resident that has been perhaps aggressive or maybe um, disruptive. How do you manage those types of residents without using restraints, either chemical or physical restraints? So we'll take a deep look into those and some of the ramifications or complications that can occur, which again, like as I said, can be more devastating than the problem itself. Another very important topic that we have to cover, and it happens because of age. As we get older, our body changes, our nutritional needs change. So you as a nursing assistant have to be aware of the nutritional needs of an older resident. Now, there is chapter 8, which is nutrition, and you're going to gain more deeper knowledge about nutrition on the older resident. But drinking water is almost just as important. Okay, so we have to keep an eye on fluid balance for several reasons. Some residents require a strict fluid balance, some don't, but you'll get to learn which ones require more of your help. So fluid balance is another topic that we'll be covering in this chapter. Input and output is a tested item in your certification exam. You have to learn how to measure input and output, keep track of it, and report it when you see a lack of output or excessive intake. So again, this is a topic that is very important because it can really have an effect on the overall condition of the residents. Again, nursing assistants are the eyes and nurse of nursing. Okay, so you have to pay very close attention to these little details. Again, many times we're in a hurry, we are performing too many tasks, we're doing things, and we overlook all these little things, right? So Again, we are a team and we help each other out. So you do your observations, report to the nurses, and then we'll take it from there. We're also going to be discussing some of the guidelines for urinary catheters. There's many residents that require or have problems with urination or elimination problems, and they may require a urinary catheter. What is your role as a nursing assistant when you see a resident that has a urinary catheter? What do you do with it? How do you clean with it? How do you maintain it? Okay, what do you report, and so on. So we'll be looking at some of those guidelines. Oxygen therapy is another topic that, or therapy that is used very commonly in the nursing homes. A lot of residents are using oxygen because they need it. What is your role when a resident is using oxygen? Can you adjust it as a patient needs it? What do you do with it? What do you report? We'll look at those topics in depth. And finally, IV therapy. IV therapy, again, is also used in the long-term care facilities. When a patient requires rehydration or has an infection, requires IV antibiotics, they may have an IV placed in them. So what is your role as to the care of the IV device? You know, what is your role? How do you take care of it? What do you report? So it's very important that you also learn those skills. We'll be discussing the residence unit and the related care. When you walk into a residence area, you're going to see some items that sometimes perhaps it's overly used. There's too many obstructions. So we are responsible to maintain a safe environment for the residents. It can be sometimes become a problem when there's too many obstacles, too many obstructions. So we have to keep that in mind, not just chairs and objects, but other items that may be not so necessary. We're going to explain the importance of sleep and perform proper bed making. Now, sleep, sometimes as a young person, you may not see it very important, but for older people, they begin to struggle immensely with their sleep. A lot of them will suffer from insomnia. They have difficulty falling asleep because they're on several medications that might affect their sleeping pattern. So imagine yourself not sleeping well one night. How do you feel? So we have to put ourselves in their position and help them hopefully obtain a better sleep during the night. And lastly, a very simple topic that we'll be discussing is about dressing and bandages. When a resident has a dressing, are you allowed to care for it? Are you allowed to change it? You know, what is your role when a resident has dressing and bandages? So we'll look at those 9 topics. Again, these are very essential skills that you have to master so that when you are working in the long-term care facility or a hospital, perhaps, you have this experience, this knowledge and skills with you. All right. So we don't expect you to be an expert once you finish the course, but at least you have the knowledge and understanding of what the importance of these skills are. All right. So this is an overview of chapter 7, and we're going to dive into it in just a bit. So hang on for the next video.